Welcome to Dartmouth-Hitchcock's cardiac surgery program. We realize that cardiac surgery can feel overwhelming, but you have a dedicated care team that's here to guide you through the process. This video will educate you about what you can expect before and during your hospitalization. There's also a second video you can watch that outlines what to expect once you go home from the hospital. There are a few important things that you can do to help yourself prepare for cardiac surgery. If you smoke or use tobacco products like electronic cigarettes or chewing tobacco, the best thing you can do for your heart and lungs is to stop smoking. Tobacco causes your heart to work harder, leads to plaque formation, atherosclerosis, in your arteries, and damages your lungs. If you can stop smoking for 2 weeks before surgery, you decrease your chances of developing pneumonia post-operatively by 50%. You can do almost anything for 2 weeks. It's important to help your heart muscle and lung function as much as you can before and after surgery. You should eat well, get plenty of rest, and walk or continue to exercise at a level that is advised by your cardiologist. You should continue participating in your regular current level of activity. Now is not the time to begin a new exercise routine. You should also avoid exposure to anyone who is sick or has recently been sick. It's important to keep yourself as healthy as possible prior to surgery. It's important to identify a loved one who can make decisions on your behalf if you are unable to make decisions for yourself while in the hospital. This is called a healthcare proxy, and you will be asked to provide the name and contact information for yours upon admission. It is important that you discuss your wishes with your healthcare proxy prior to admission, and he or she needs to be comfortable making decisions on your behalf if needed. You should discuss these issues with your surgeon prior to surgery. Another important point of preparation is establishing the details of your advance directive. An advance directive is a document that describes your choices about life support. It is important to have an updated, complete advance directive on file prior to your surgery. If you have any questions or need help completing your advance directive, please call the Office of Care Management. Please make sure your surgeon has your most up-to-date medications list. This is important because some medications, like blood thinners, may need to be stopped prior to surgery. Your surgeon will provide you with specific instructions on when and how to stop certain medications. Please do not stop taking any medications before surgery without talking to your surgeon first. If you're started on any new medications prior to surgery, it's important that you notify your surgeon immediately. If you work, you may need to plan to be out of work for up to 12 weeks. If there's paperwork needed for your employer, your doctor or nurse will be happy to assist you in completing that paperwork before surgery. Now is also a good time to start planning for your discharge from the hospital and ensure that your home is ready. This may include removing scatter rugs and trip hazards, obtaining a shower chair or other assistive equipment, preparing meals ahead of time, and communicating with your support system. You'll need to make a plan to have someone with you at home 24 hours a day for at least 7 days after going home. The afternoon before surgery, you will receive a phone call from same-day surgery confirming your surgery for the following day and time of arrival. The night before surgery, you need to shower with the special antibacterial soap that was given to you in pre-admission testing, and be sure that you dry off with a freshly clean towel. Do not apply any products such as lotion or powders after washing with the special soap. The night before surgery, you will not be allowed to eat or drink anything after midnight. This is important because your stomach needs to be empty. Your surgeon may advise you to take some of your morning medications with a small amount of water. The day of surgery, you will want to arrive at same-day surgery at your scheduled time. The closest parking is in the parking garage. Jewelry, including wedding rings and piercings, needs to be removed prior to arriving at same-day surgery and left at home. Other valuables like wallets and money should also be left at home, as they can be easily lost. Please make sure you bring all assistive devices, including glasses, hearing aids, dentures, and your own CPAP device with you to same-day surgery and give them to your family. Once in same-day surgery, the nurses will begin preparing you for surgery. This may include additional blood draws, starting an IV, and other tests ordered at the direction of your surgeon. Your family may stay with you in same-day surgery until you are taken to the OR. Once you go to the operating room, your family will wait in our waiting area. Once you're in the operating room, your procedure will last several hours. During surgery, you'll have a breathing tube in place and your body will be supported by a heart and lung machine. The surgeon will update your family once the operation is complete. Once the operation is complete, you will be brought to the cardiovascular critical care unit known as the CVCC. You will stay in the CVCC for at least 24 hours. On arrival to the CVCC, you will have a breathing tube in and will remain asleep under anesthesia for about 4 to 6 hours before waking up. Your family will be able to visit once you are settled. You will be attached to multiple pieces of equipment for monitoring, including an IV in your neck. You will also have a tube in your bladder to drain urine. These are all placed in the operating room after you are asleep. The nurse will start to wake you up while you still have a breathing tube in place. This may be uncomfortable, but should only last a very short time. Once you are awake and following commands, the breathing tube will be removed. You will be asked frequently about your pain level and offered pain medication to keep you as comfortable as possible. While we will not be able to take all of your pain away, our goal is to make you comfortable so you can tolerate moving, coughing, and deep breathing. Once the breathing tube is out, we will start increasing your activity as tolerated. This starts with sitting at the edge of the bed. Once you're ready to move out of the CVCC, some monitoring lines and devices will be removed. After the CVCC, you will be taken to the Intermediate Cardiac Care Unit, the ICCU, or the Cardiac Special Care Unit, the CSCU, depending on your monitoring needs. We will continue to assist with pain management in order to focus on rehabilitation and increasing your activity level. The nurses will teach you steps to assist you in protecting your incision during activity. You will be attached to a small box that will monitor your heart until you are discharged. Criteria for discharge include the ability to walk around the unit for 5 minutes without any symptoms, walk up and down stairs, adequate pain control, normal heart rate and blood pressure, normal urination, and normal bowel movements. This usually takes 4 to 6 days from the time of surgery. Once the provider has cleared you for discharge, all monitoring and remaining IV lines will be removed. On discharge, you will be given a printed copy of discharge instructions, which include activity limits, medication list, and scheduled follow-up appointments. The nurse will review everything with you and your family. After surgery, you will not be allowed to drive for at least 3 weeks or until advised by your surgeon. Coming away from surgery, simple activities of daily living may feel more difficult than usual. It's normal to feel emotional, but don't be discouraged. Things will gradually improve the farther out from surgery you get. It's common to feel fatigued for about 3 to 4 months after surgery. You may need frequent naps, so it's important to pace yourself throughout the day and to listen to your body when it needs rest. That being said, we also encourage you to walk every day as much as feels comfortable. Appropriate exercise will better facilitate the recovery of your strength. If you find yourself experiencing decreased appetite, still do your best to eat enough each day. Just as with exercise, nourishing your body and eating things that appeal to you is conducive to your recovery. Once home, there are several important things that you need to watch for as you continue to heal from surgery. If you notice any of the following symptoms, please contact your surgeon. Bright red bowel movements, chills or fever greater than 101.5 degrees Fahrenheit, coughing up bright red blood, fainting spells, new fast heart rate, new onset nausea, vomiting, or diarrhea, severe abdominal pain, shortness of breath not relieved by rest, sudden severe headache, worsening shortness of breath, bleeding or oozing from your incision, any urinary complaints, weight gain of more than 5 pounds in 24 hours. As is often the case with complex surgery, there's a lot of information to retain, but we'll be with you every step of the way to answer any questions that you might have. We wish you the best, and we'll strive to make your experience a smooth and comfortable one.
When I found out that I needed surgery, I was not at all prepared for that because I did not experience really any symptoms.
I thought at first, I never thought I was having a heart attack. I had had a couple of days that were really full, the 2 days before.
You can't go into any major hospital and surgical experience without having some concerns. But my confidence in the staff was very high. And I just expected the best outcome.
This is where I choose to go at Dartmouth-Hitchcock. We had more than 20 years experience in the system, and my husband had 19 years of cancer, and we received such good treatment there that was my first choice.
One would expect that there might be quite a bit of pain associated with a procedure like this. There really was not.
I didn't really feel intense pain through this whole experience. And I always thought if you were having a heart attack, that would probably be the worst pain you could experience. And that wasn't what happened to me.
For me, the most surprising and shocking experience in the immediate postoperative period was how completely incapable I was of doing anything for myself. On the unit, the staff could not have been more sensitive, more caring.
They respond to that buzzer pretty quickly. I was really impressed with that.
Everything that I needed was attended to. And when you have had open heart surgery, you have quite a few needs.
There was just, really kindness and compassion and a great deal of competency, because I think I'm doing very well. If you've spent your life taking care of other people, but you tend to minimize any symptoms you have and not listen to your own body, listen, it could make a difference between your being here and your not being here.
You're not going to leave the hospital and get up and go shopping or, lift your child or your grandchild. It takes a very long time. It's well worth the time.